We do about 30 to 35 laser procedures per month. Believe it or not, about 95% of the people I see end up having SLT done as their primary therapy or replacement therapy. It's become really rare that I use glaucoma eye drops as a first-line therapy. Well, the best thing about the SLT, and this sounds contrite, is that it just works. The SLT drops pressure. It's a rare patient that I have that I do an SLT on that does not get a satisfactory pressure decrease. So I think its efficacy is probably the most important point of using the SLT laser. It's a rare person that I have to repeat the SLT or get no pressure response with it. Now with SLT, it's just very rare that I'll write for glaucoma eye drops on the first sweep when I see a patient. When I explain the drops versus laser and the risk and benefits, it seems about 95% of the patients are very much interested in having the laser done. So it's kind of changed my strategy in treating glaucoma. I think really it helped my practice grow because I've had so many patients that I've done SLT laser on, have them no longer take their eye drops, which they've been buying and having to remember to put in every night, walk around with some red eyes the next morning. They've actually gone out and told their friends about the laser, and I've had just several people come in, and one glaucoma patient talks to another and word of mouth gets out there, and all of a sudden people are coming in and asking about this laser and kind of telling me that they're tired of taking their eye drops. Well, there's several other benefits. Probably the one that comes to mind first is it's repeatable. In the old way we took care of glaucoma, we often used the laser as a last-ditch effort after eye drops failed. But the repeatability of SLT is wonderful for the patient. So if the pressure starts rising after 3 to 5 years, we can just repeat the procedure. The second one probably would be the fact that it saves the patient a lot of money. Copays keep going up on glaucoma drops, and the patient is facing an increased monthly charge to stay on their current glaucoma drops, not to mention the red eyes that several of these drops give the patient. I also enjoy it because I have some people that come in maybe with a failed bleb surgery and they're kind of at wit's end because they don't want to go through a second surgery, and the SLT works very nicely to give them a little bump in their pressure decrease. We certainly give some information to the patient, education while they're here considering an SLT laser, but then we direct them to their website, and they're able to go onto the website and get a much more in-depth education of not only glaucoma, but of course how the laser works for them. Absolutely. I mean, Lumenis has been kind of in the forefront with tech support, as I mentioned earlier, website support. They're very much into patient education, and it just makes my job easier because, let's face it, we only have so much time per patient, and so it's very nice to give them either the educational materials that Lumenis provides us, and then the website link is again invaluable for the patient to go on and learn a little bit more about their disease process, namely glaucoma, and a little bit more about how does the Lumenis laser work. And some of them come back extremely educated and kind of tell me a few things that they saw on the website, which I think is kind of neat. Well, there really wasn't an obstacle for me. Once I sat down and did the math, I realized that in the first 6 to 12 months, doing lasers on my existing glaucoma patients and getting them off eye drops pretty much made the laser pay for itself after just 6 to 12 months, and after that period, everything on that was just pure profit margin. So there really wasn't an obstacle, and I think any ophthalmologist that treats glaucoma can do those same numbers in their practice and realize that it's going to be a very short time before they can pay for the laser just by doing their existing glaucoma patients. I think the biggest recommendation is that it works, and the people come back and they're very satisfied with their outcomes. They're having very large pressure drops, so they feel comfortable and confident not only in the laser but in you, and I think it really kind of builds your physician-patient relationship. So again, I use the word efficacious. It does what it says it's going to do, and the results are pleasing for both the patient and the physician. Well, and I have talked to a few of those colleagues and called them up and told them just take the leap. You're never going to look back. You're never going to second guess yourself. Once you start using it and once you start getting the results it provides and the patient satisfaction, you'll never think that you made the wrong decision. I've always said to every ophthalmologist considering buying this SLT laser is if you're treating glaucoma, you need to have an SLT laser, period. Probably the best thing to do is just get education, maybe talk to an ophthalmologist like myself, a general ophthalmologist who treats a lot of glaucoma, and just get a better lay of the land, or come into their office and give it a try on some of their glaucoma patients and see the results and get some confidence with the laser. But I think once they do that, they'll certainly go ahead and buy a laser. I've been a strong supporter of the SLT laser. Just this morning I scheduled 2 cases before I came in and did this. So anyone who's unsure, just to give it a try, give somebody a call who owns one. It's great to have in your office. I schedule it all week long, and the patient convenience wonderful. It saves them money by not having to go to a surgical facility or hospital to have it done. I think it's a good marketing idea for your practice to grow your practice. And again, you're going to pay for it in the first 6 to 12 months.